Hello, my name is Sunil Dand and thank you for watching Frontline Doctor Scripts. In this video, we're going to be talking a little bit about the hospitalization process and what questions you and your family need to be asking. Generally speaking, there are two main ways that people can be admitted to the hospital. The first, most common way is via the emergency room. The second is for a planned procedure or operation, what is known as an elective admission. Being in the hospital can be a scary and confusing time, but despite the best efforts of your staff who are professional and caring, there's still multiple opportunities for things to slip through the cracks. That's why it's important you and your family are well informed and ask the right questions. First and foremost, understand the exact reason why you're being admitted to the hospital, what the admission diagnosis is, and what the initial treatment plan is. You may be taking lots of medications at home. It's absolutely imperative that you communicate these to your physician and nurse, the exact medication names and dosages. In healthcare circles, we call this medication reconciliation, and unfortunately again, there are multiple opportunities for confusion to arise. Certain medications you need to be particularly careful of include insulin and other oral diabetes pills, blood thinners including warfarin, aspirin and clopidogrel, blood pressure medications, inhalers and steroids. Every day that you're in the hospital, you will be assigned a main attending physician. You may well be seeing other specialists as well, but typically you will only have one main attending physician, usually an internal medicine specialist, and that will be your go-to person while you're in the hospital. Every day, the plan should be clearly communicated to you, any abnormal tests you've had, and any tests you are going to have and the reasons for them, any medication changes that are being made, and also, of course, your anticipated discharge day. Ideally, in many hospitals, they have whiteboards in the hospital rooms, and these are the best places to communicate a lot of these answers. Keep in mind the following during your hospitalization. You may well have an intravenous line inserted, and the duration of this should be made clear to you. Potentially every excess day that this is in could lead to a risk of infection. Same goes for other foreign devices like urinary catheters. Generally speaking, it's a great idea for you to ambulate and get moving as soon as possible. Back in the old days, it was thought that people who are in the hospital need complete bed rest. We are now moving away from that notion completely, so speak to your doctor or your nurse if you feel like you're lying down in bed excessively. By the same token, you may be prescribed a medication, usually an injection such as heparin, to lower your risk of getting blood clots. If you're not receiving this injection, speak to your doctor or nurse. Food and sleep are two of the most important things our body needs, yet they're also two of the most common complaints that patients have when they're in the hospital. Your diet may be changed for a reason, and if you're unclear on this, speak to your doctor, nurse, or even the nutritionist. If you're finding it difficult to sleep because of excess noise, also speak to your nurse, and hopefully something can be done to lower the noise levels and enable you to get a good rest. Great! The time has come when you're feeling better and are ready to leave the hospital. But be careful, because the first few days after leaving the hospital are often a time at which your body is still fragile and recovering. Before you leave, you will be given a list of discharge instructions, and on this should clearly be listed certain things. These include what physician or physicians you need to follow up with, what abnormal tests you had during your hospital stay and what follow-up they need, any medication changes that have been made, and typically these are discussed with your primary care doctor at your next visit, and finally, what symptoms to monitor yourself for over the upcoming days. Thank you and good luck.